Minister of Health Dr. Frank Anthony told the Committee of Supply on Wednesday that $121 billion allocated for the health sector entails rolling out his ministry's planned influenza vaccines agenda. Opposition parliamentarian Dr. Karen Cummins inquired about the key strategic actions emerging from the National Health Strategy. Minister Anthony highlighted a significant advancement in laboratory services at the National Public Health Reference Lab. At the end of last year, the Pan American Health Organization World Health Organization accredited the lab, designating it one of the regional centers responsible for influenza surveillance.
So this year, the vaccines that are made for influenza, some of the samples came from our lab because, as you know, every season, influenza season, the previous season, you take the samples from that to try to predict what type of vaccines you will need in the new year. And so we have been able to supply WHO with samples.
He added that previously Guyana had not been administering influenza vaccinations, but this year the program will commence.
We would give them first to the healthcare workers and to older people in our population.
Minister Anthony stated that Guyana has achieved 30% of its national health strategy goals and is aiming for 45%, with the possibility of surpassing this target due to the rapid implementation of various initiatives.
We have at least 14 histochemistry tests that we can now do at the lab. And among the other things that we're able to do, if somebody had a biopsy for breast cancer, when in the past, just maybe about a year ago, if that biopsy came to the Georgetown Public Hospital, they took sometime 3 months to turn that sample around.
The minister added that in the past, breast cancer diagnoses were conducted in a very crude manner, providing results that only indicate malignancy without the ability to differentiate between various types of cancers.
This current lab allows us to do those differentiations. And so now when somebody is diagnosed with breast cancer, we can actually tell them what type of breast cancer. And that also would inform the doctors on the treatment.
Tiana Cole reporting for the HGP United News.